New York and New Jersey are two of the states hardest hit by the coronavirus. They account for a combined 45% of all cases nationwide. But despite that figure, the neighboring states only received 9% of federal aid to hospitals. As Congress edges towards a fourth rescue package, a group of bipartisan lawmakers from New York and New Jersey have asked Speaker Pelosi and Leader Mitch McConnell for a separate $40 billion fund to be distributed to states based on infection rates. Well, joining me now is Democratic Congressman Josh Gottheimer. He represents northern New Jersey's 5th Congressional District and is spearheading this effort for the New Jersey delegation. Congressman, thank you very much for joining us. I want to ask you, though, can you sort of tell us a little bit more about the details of this proposal? You represent, or you presented actually this to congressional leadership. What are you hoping will come out of this?
Well, thanks for having me, and I think you summarized it very well. The challenge is we've got nearly half the cases in the country between New York and New Jersey, and yet we've got about 9% of the total resources for our hospitals. And of course, we're in the eye of the storm, unfortunately. In my district alone, we have more than 22,000 cases in the counties, and more than 1,000 people have lost their lives. It's horrific. And of course, it's putting a huge stress on our state, on our municipalities, on our hospitals. So what we've asked for is let's set aside additional resources for the states that have been hardest hit. And that's exactly what every Democrat and Republican in our two states are asking for, to try to give extra help. Just like we would if there was a natural disaster, we'd focus on where the hurricane or the tornado hit. And the same thing has to happen here.
How optimistic are you that you'll get what you're asking for in this package?
Well, I think there's going to be two packages, one that we're going to do this week, hopefully very shortly, which will give extra, and there'll be more money for our hospitals. We're fighting to actually ensure that there's resources for the hardest hit states. So I'm hopeful. We don't have the final details of that package yet. And then on the next package, I know that's something we're all pushing for. If you look at it a different way, on average in the hospitals in my district, we're getting about $6,500 per patient. And in West Virginia, they're getting more than $400,000 per patient. Now, when we wrote the CARES Act, the idea was that we didn't know where it was going to hit. We didn't know where the virus was going to go. So we made sure that every state was able to have access to those resources in all the hospitals. But now we have a better sense of where the eye of the storm is, and I think we've got to obviously respond accordingly.
You know, your district continues to be, as you mentioned, the epicenter of the virus in New Jersey. More than 4,000 people have died in your state, 85,000 cases in your state. Where are you seeing this headed? Is the curve flattening?
I mean, it's just horrific. I see the curve flattening? Yes. In fact, as the governor has indicated. You still see every day, though, thousands getting the virus, or at least getting tested with results that are positive for the virus, because many more, as you know, are not getting tested, and still losing so many lives every day. And we're especially in the last week to 10 days have seen a huge spike in nursing homes and long-term care facilities. So what really concerns me is just a growing percentage of the number of loss of life every day is part of these long-term care facilities. And it's just horrible what's going on. They're spreading like wildfire in these facilities.
You know, you mentioned how quickly this is all spreading. You and your so-called Problem Solvers Caucus on Monday released something called a back-to-work checklist for getting the country up and running. Tell me a little bit more about what this checklist entails. How do you expect it to be implemented if states and the federal government are still wrestling with this idea of testing? What is the responsible thing to do in this moment?
I'm glad you brought it up. There's 50 of us, half Democrat, half Republican, that came together and spoke to experts on the health side and, of course, on the economic side, trying to deal with these twin crises of health and economic, and said, what should that checklist look like? Because I know, like all of us, we're wondering, what should I be looking for to reopen? What is to go outside? How should I feel comfortable to go back to work? What do I need to know? And we tried to put together a list that we thought could be easy to access for governors, of course, for work we're doing in Congress, and of course regulators, and tried to make that list of including things like obviously rapid testing, and of course much more testing available for people, dealing with supply chain issues, so we can, if God forbid we have another spike, can our hospitals handle it? Do we have, for our frontline healthcare workers, do they have masks and all the equipment they need? Do we have enough masks to send people to work, and for our first responders? And then there's economic issues. How do we make sure that our businesses can survive this, businesses of all sizes? We know we're pushing so hard for the PPP program for small business loan forgiveness, but what else do we need to do in terms of people being able to pay their rent and their mortgages? This has such a huge ripple effect we tried to make a list of what we thought should be front of mind and the learnings that we could bring forward so we're prepared for the future.
What are you most worried about in the coming months?
I'm probably like you and everyone. I'm worried about another outbreak. I'm worried about our people staying healthy and our families staying healthy. And I'm very worried about our economy and our businesses. We're an incredibly resilient country, and I'm an optimist, and we'll get through this. But I just want to make sure people have jobs and that people's businesses are operating, and people who spend a lifetime building things, that it's there for them and for our country. So you've got health issues and economic issues, and both of them are weighing heavily. But again, I really believe if we stick together, if we avoid partisan fights like we've been doing, if we work together, we will get through this. We will be stronger.
Amen to that. I think a lot of people are hoping to see more politicians working together. Congressman Gottheimer, thank you very much for joining us with an update from your district in New Jersey.
Thanks. Stay safe.